Colleagues, this Saturday, October the 9th, is PANS and PANDAS Awareness Day. You may be asking yourself, what is PANS or PANDAS? Well, in October 2018, my wife and I had never heard of it until we were searching for answers related to a very serious medical matter that seemed to develop almost overnight in one of our children, Sophie Bradford. PANS is a pediatric acute onset neuropsychiatric syndrome, and PANDAS is a pediatric autoimmune neuropsychiatric disorder that's associated with strep throat, often strep B. In our experience, our then 11-year-old daughter, Sophie, had changed into someone completely different in a matter of days. Sophie experienced abrupt and sudden dramatic onset of obsessive-compulsive disorder, restricted eating and weight loss, deterioration of learning, fits of uncontrollable rage, severe anxiety, and other neuropsychiatric symptoms. PANS and PANDAS is often misdiagnosed as severe attention and/or anxiety disorders or mental health issues and others. This misunderstood diagnosis is often due to the lack of awareness within the medical community about these disorders. My wife, Shay, would not settle for the answers we were receiving from our doctors because as a mother, she knew that there was an underlying issue that had not yet been identified with Sophie. My wife only learned about PANS and PANDAS because she was standing in the waiting room of a pediatric psychiatrist while my daughter was receiving help or treatment, and another mother in the same lobby started talking about her son and PANS and PANDAS. And my wife pulled the mother aside and started to ask more, and that's when we were first introduced to PANS and PANDAS. We pressed our doctors for more testing after learning about PANS and PANDAS, and our doctors ordered a full round of blood work on our daughter. The blood work eventually surfaced that my daughter had an undiscovered Lyme disease, as well as mold toxicity. And we would have never known this had we not pressed our doctors. So once we now knew that she had been diagnosed with PANS because of the undiscovered Lyme disease and the mold toxicity, we learned about what the treatment options were. And ladies and gentlemen, the treatment options was a $5 to $10 round of antibiotics. So in a couple of weeks after my daughter, who we had been searching for months for answers, hospital visits, etc., $5 to $10 rounds of antibiotics got my daughter back onto a road of amazing recovery. So it's now been over 3 years since we dealt with the initial trauma, and it was truly trauma. I would never wish this on any family, with Sophie's medical issues. My Sophie Soph is back to a fun-loving, horseback riding, 14-year-old teenage girl. Yes, she will have a lifetime issue of managing her Lyme disease, but at least we know its existence and how to manage it best possible. Families across North Carolina, like the families of Katie Conlon and Charlotte, and Jackson, Hauser, and Cornelius have dealt with, and in some cases continue to deal with, PANS and PANDAS. Many families go years undiagnosed and or misdiagnosed because their medical providers simply may not be aware of PANS and PANDAS. There is no doubt that early detection and antibiotic treatment can save families a lot of stress, turmoil, and even hundreds of thousands of dollars of medical expenses that health insurance plans in North Carolina will not cover. There has been a published consensus paper from Stanford University, a 66-page published paper from the National Institute of Health, and over 45 states either having university-based treatment clinics or Health and Human Services and council-based treatment recommendations, most of which North Carolina healthcare providers remain unaware. Early National Institute of Health data shows that 1 in 200 children in North Carolina may have PANS or PANDAS. And Stanford shows data 1 in 50. This is why bringing awareness to PANS and PANDAS, not only in North Carolina, but across the world, is incredibly important. A $5 to $10 round of generic antibiotics with early diagnosis can change the trajectory in such a positive ways for children and young adults across our world. Thank you, Mr. Speaker.